Right now, a historic plan to erase the medical debt of 1 million Arizonans. One of the key people involved tells us how it works and why it matters. Also on today's show, the Senate race shakeup, why Kyrsten Sinema bailed out, what a Ruben Gallego versus Kari Lake matchup will look like, and why Lake needs to worry about Stephen Richards' defamation suit. We start with a historic plan to wipe out the medical debt of 1 million Arizonans. Democratic Governor Katie Hobbs will use up to $30 million in federal COVID relief money to cancel that debt. Other states have similar plans, but Arizona's is the most ambitious. It almost sounds too good to be true. So how does it work and why does it matter? Joining us is Jeff Smedsrud of Scottsdale. He's a board member at the nonprofit called RIP Medical Debt that has a contract with the state for the debt cancellation. Welcome to Square Off.
Hey, thank you very much. Pleasure to be here.
You told me you have your own experience with medical debt dating to your time as an entrepreneur and dealing with colon cancer.
My experience are not nearly as dramatic as some, but many years ago I was starting a new business and had tapped out all my credit cards. And in the midst of that, I was diagnosed with colon cancer. And in that process, had bills that I couldn't pay right away, damaged my credit ratings. And I also learned from that experience, as I talked to others, that the issue of medical debt was always coming up with people who were struggling with cancer or other types of diseases. And I thought it was time to try to do something about that.
So how did you get involved with RIP Medical Debt?
Well, I've been a background in the insurance and healthcare finance business, and I heard about them. They were started 10 years ago by two former debt collectors, and I got together with them, asked to be involved, and have helped them grow significantly in the last few years.
So I didn't know that piece of it. Debt collectors helped get this off the ground?
Two former debt collectors saw the light, so to speak, during Occupy Wall Street, and they decided instead of buying debt to get money from consumers, they would buy the debt, raise funds from other individuals, and then forgive the debt, make it go away.
And you've seen the impact on lives having done this now for several years.
The impact is huge for individuals. They are able to access, once their debt is gone, they were able to access health care with preventive care instead of the emergency room. Their credit scores go up. They are able to spend more money, which is good for the economy. Their mental health improves. It sets forth just this wonderful ripple of hope, and it expands.
So I said before, it almost sounds too good to be true, so let's walk folks through how this all works. Starting with, who's eligible for this?
Well, those eligible are people under 400% of the federal poverty level, or those whose medical debt is more than 5% of their annual income. That's the eligibility requirement.
And 400% is for a family of four?
Is about $120,000. For an individual, it's about $60,000.
Okay. But, here's the big but, people who have medical debt can't apply, correct?
No one can apply, but if you had debt that is in collections with a credit bureau or debt that's late and overdue with hospitals, providers, we buy that debt from hospitals, providers, debt collectors. We then in turn raise capital or utilize capital such as COVID relief funds, and then send letters out to the individuals saying, you know, Jeff, anonymously, we've wiped out your medical debt, improved your credit scores, and it's amazing transformation for individuals.
So I might have medical debt right now. I might be eligible for this. I won't know whether your organization's going to pay it off or not.
You won't know until you see a letter in the mail.
How long would it take for that letter in the mail to arrive?
Well, some of it will happen quickly, and we expect this program and the funds available and working with the hospitals and providers in Arizona to have a huge impact over the next 2 years.
over the next 2 years, this will
Right.
play out. The $20 million to $30 million you
Right.
expect will be drawn down over 2 years.
We anticipate that. We don't know exactly how many people, but we estimate, based on prior experience, about 1 in 7 Arizona residents will have good news in the mailbox soon to come.
1 in 7. Are there some debt collection agencies or hospital systems, healthcare networks that are easier to work with than others?
Well, there are. We work with more than 125 hospital systems around the country, many providers. I'll never say anything bad about the hospitals and providers. They give great care, but each has their own unique systems. And the one thing I'd tell consumers is learn about it, learn about their protocols, understand what charity relief and payment methods might be available from the hospital or provider.
Is the payment, the clearing of the debt, taxable to the individual?
Because we anonymously clear the debt and we're a third party, it's a non-taxable event to the consumer, to the individual. If I forgave my son's debt, it would be a taxable event for him. But this is a third party, it's completely non-taxable.
And so, say someone listening has $5,000, $10,000 or more in debt. They meet all the guidelines. Should they sit at home and say, hang on, maybe I should just wait and see if you clear my debt?
I'd encourage everybody to use the resources they have to pay down their debt. But no, it's not a wait and see, but get involved, be active, talk to your hospital, talk to your provider, learn more about all the available resources that are out there. And, you know, maybe something good is going to come in the mail that puts a smile on your face.
But don't just wait around for something good to come in the mail, because you can get into deeper financial trouble if you...
But don't wait.
Yeah.
Do the right thing, do what you can. But learn about the processes and the procedures in the hospitals and providers.
I mentioned how ambitious this program is. Is this the largest one, the largest pool of money you've had to work with?
Arizona is the largest public-private initiative ever to wipe out medical debt. We expect, and applause to the leadership in Arizona, we expect other states to say, I'm going to follow suit. I'm going to beat this. So I think it's good for America that Arizona's taken this leadership position.
All right, got to end it there. Jeff Smedsrud, thank you so much for what you're doing.
Thank you. Pleasure to be here.